So for NG tube placement, the first thing I want to do always when you walk into a patient's room is hand hygiene. So then you can also grab gloves. I like to put the gloves in my pocket until I am done measuring out the amount of tape that I will need to secure the NG tube. So I'm going to do my hand hygiene, walk over to the patient, and introduce myself with my AIDIT. Hi, my name is Jen. I'll be your student nurse today. And today we have an order from the doctor for an NG tube placement. Before we begin, can I please have your name and date of birth, and if you have any allergies? So then you want to look at the patient's bracelets and make sure that what they're saying matches their bracelet. So we'll have Pat Snow, date of birth 12/16/60, and then there's no known allergies. So we always start there. Okay, so this procedure should take about 10 minutes. It's a little bit uncomfortable, but just try to relax. And if you have any questions, please let me know. So I'm going to thank you in advance, and then I'm going to gather my supplies. So what we need for NG tube placement is this towel. It's going to go on the patient's chest because sometimes when you insert an NG tube, there's some drainage from the nose, or they might have a little bit of vomit because it's going into their throat. So you want to put this on their chest. Here is our NG syringe, and you're going to want to bring over a 20 ml Just Air bolus. This is going to be for identifying the placement of the tube later. You want tape for securing. You want, this is the lubrication for the tube to make it much easier to administer down the throat. And here is your nasogastric sump tube. This is it right here. Okay. So what I like to do is take all these things to the bedside and then make sure you have your gloves because you don't want to administer the tube without it. And water for the patient so that it makes the tube go down a little bit easier as they swallow. Okay, so we've got all these things with us, and you can put the table at your bedside too if you want to put your water and stuff on there. I'll just bring it on over. Alright, so the first thing you want to do is put the patient in high Fowlers. So you're going to sit them up. Alright, so now we have a pen light. You always have your pen light with you no matter what. We are going to look into the patient's nose to make sure the nares are patent and there's nothing that's going to block the tube from entering. So you just make sure, just like this, and they look good. So then we need to measure our tube, and this part is really, really important. So we're going to remove the tube. And you kind of want to see where you are in the patient here. So we start with the very tip of the tube. This is the part that's going to go into the patient's nose right here. And what you want to do is start with this tip right here, and you're going to measure from the tip of the nose to about the earlobe, and then you bring it down here to the xiphoid process. After that, you're going to mark it, and it's usually about, on an average, 50 centimeters, but it varies, so make sure you look really closely at the line on what you're measuring here. So I'm going to hold that. I'm going to remember that it's at the 50, and here is my tape. And if I had gloves on, this would be much more difficult. So here's my tape, and you can just use your emesis basin here and kind of put those on the side, and that's for securing it to the patient's nose. And then this part is for measuring the 50. So we go back to our 50 mark, and we put our tape here. That way we know exactly how far to go in. Once this tape reaches the patient's nose, you know that that's the amount of tube length they're going to need to suction. Okay, so now that we're ready to go, we've got our 20 ml air bolus. I'm going to apply my gloves. I'll do a little hand hygiene first again. Okay, so here's this. And now we're going to assume that the patient has arms So they're going to be able to hold this. And what we're going to do is have them hold it. And we're going to open this. But before we do that, we're going to place the towel that we need over the patient's chest so that there isn't any. Okay, now we're going to assume that they're holding this cup with their hand at the moment. Okay, so we open our lubrication here. Take the end here. And we're going to insert it and make sure you get a lot of that on the end. Like this. Okay. So now the first thing you want to do is make sure their head is either straight or they can even look up slightly. And as you advance, you're going to wait. You're going to kind of push it in there like this, and you're going to wait, and you're going to look into the back of their throat, the nasopharynx, and make sure you see it back there. Okay, at that point, they're going to bend their chin to their chest and take sips of water on your command. So you're going to advance the tube and have them sip, swallow, sip, swallow, sip, swallow, sip, swallow, sip, swallow, sip, swallow. Now we've got to our tape. So we're going to take this away. We're going to grab our tape that we already have pre-cut here. And we're going to tape it to the end of their nose. Like this. Make sure it's nice and secure on there. Okay. So now we need to put our stethoscope in and listen for the air bolus to make sure that it's in there. Okay. So you're going to put it right where the xiphoid process is in the stomach here. You're going to take this plastic bit out. There's this. All right. And now you're going to listen for the whoosh of air in the stomach. And then you're going to confirm whether or not you've heard it. So we'll say that we've heard it. And then what you want to do is aspirate for 20 mils of gastric contents, just like this. And then when you see the stomach contents come into the syringe, you want to kink this off. Otherwise it will come splashing all out on you, and take it off very carefully. You can put this in your emesis basin and discard. Okay, so then we want to connect it to low suction with this again. Okay. And it's going to be intermittent, and you want to make sure it's in the green here. And there we go. I'll do it again. I just want to do a run through.